respond to the growing number of refugees and other OR-eligible populations. So I'm very fortunate to be joined by a very distinguished panel of researchers and practitioners. We have, I think by now you all know Milad very, very well, as he mentioned earlier. We also have Jonathan Amisi from the University of Utah, Ellen Beatty she's the Vice President of Program Excellence from the International Rescue Committee, Emma Shah, who's the Deputy Director of Virtual Services from IRC, Emily Kaiser, who's our Senior Digital Communications Officer who oversees Settle In. Hopefully you're familiar with Settle In and CORE, those of you who are practitioners. They are culture orientation technical assistance programs. And lastly, very honored to have Jeanie Annan here, who is IRC's Chief Research and Innovation Officer and the head of Airbel. And if you don't know Airbel, I encourage you to check it out. It is our research and innovation lab at the IRC. Jeanie has agreed to be our respondent for the panel, so she's going to give us some closing thoughts after. So the way this works is each of our panelists will spend about 5 minutes discussing the technology that they want to share with you. I'm going to ask them a question, and then at the end, Jeannie's going to ask them some additional questions and reflect on what she's heard. And then we'll open it up to you all and any questions you might have. So if you think of things as you're going along, jot them down, and we'll get to those. So we're going to start out, and I've asked everyone to either stand there or stand up here, because I know if you're at the back of the room, it's hard to see. So we want to make sure everyone, that they can see you and you can see them. So I'm going to start with Milad and Jonathan, who are going to tell us all about copper.
Just stay away from this mic, because you have that mic, right. And I'll use this mic. I think everybody else is mic'd up. No, but not in the distance. Like say, just on that side of the podium.
Here, cool.
Cool. Hi, I'm Milad.
And I'm Jonathan.
Yeah, this is something that we worked on in our design research studio a few years ago, named Copper. One person who's not here, Will Napier, he is studying now at RCA in London, but he sends his best regarding the workshop. Jonathan, do you want to tell us about Copper a little bit, and I'll backfill?
Yeah, sure. Copper is basically designed to help clients who came to the United States and they have a hard time knowing how to navigate the system. Basically, whenever the caseworker is not around, out of office time, Copper should be there to answer most of the questions that the client has.
Yeah, so those off hours were kind of the impetus for us to prototype. And this was when large language models were just kind of coming about, and in terms of like popular culture, and like Noam Chomsky was writing about it. And so there was ChatGPT hadn't exist, but one of our impulses for it was, how do we make a hardware device around under $30 that could connect to the web, that could be a virtual caseworker with anonymity in mind? So meaning that it could be connected to someone's calendar, but making sure that it doesn't operate like the Alexa where it's always listening. There are safeguarding methods in which how it works.
Yes, that was one of the biggest points, because we know that everyone has different backgrounds and they might not take things well. Like, for example, a device sitting in your house, just listening to you, everything that you're doing, that might make them uncomfortable. So that was one of the things that we had to think about and say, okay, how can we make people feel more comfortable with this device? How can we make someone understand that their data is not being shared somewhere? So those were one of the things that we had to think through and make sure clients are comfortable with the device.
Yeah. I think that's it as an overview, but we'll save for the panel in terms of the details or what's underneath that Copper object itself. Yeah.
Okay, I get the first question as the moderator, so I will take it. What are some of the potential risks, ethical risks and ethical considerations that you thought about? You mentioned a few on privacy, but what other ethical considerations did you think about when you were building this?
Myself, I would say that first, there is information like Social Security. For example, if we think of clients who work with the IRC, basically IRC has most of their sensitive information, and for the device to talk to them, it will need to access those information. So how can we make sure the device doesn't have access to everything, but at the same time help the client in a way they need? So we thought of maybe connecting clients' accounts with Google, because Google has privacy. Basically, like it has limits, boundaries. So if a client's account is connected to Google, we don't have to do so many things to try to find a way we can protect the client from leaking their data to anyone else. So that was one of the things. Milad?
Thank you. Sorry, I'm going to lean this way for feedback. The other, I think, aspect is kind of like the aftertaste of using these devices, which is the inherent trust you have of listening in different languages to it. So we tried Swahili, Farsi, Spanish, and they all had a different tone to like the trust you build with the device. But it's really important in the ethical realm of not to immediately trust the information it gives you. So I think that's one aspect in terms of ethics, that it's not about how it, the initial data interaction, but the after, like how do you actually think about that? And how do you go to your actual caseworker afterwards? So kind of like a two-step authentication that we're all very familiar with. This would be similar to that.
And we'll be able to test it out, right, in the playground? Will it be there in the playground, or you'll be talking about it more in the playground?
We'll be talking about it with something else Jonathan is working on that's really exciting.
Okay. Okay. All right, we're going to go on to the next. I will open it up for questions after, but we want to talk about next newcomers. And Ellen Beatty is going to come and tell us a little bit about this technology.
Hey, good morning, everyone. Can you hear me all right? Yeah, I'm Ellen Beatty. I want to say that I'm actually standing in for Duncan Lawrence, who is our Director for Innovation within our Resettlement, Asylum, and Integration team. Unfortunately, he had a family emergency and couldn't be here, but he really is driving a lot of this project, so I wanted to be sure to mention him. And so Newcomers, what it is, what I'm going to tell you about is a project that is still underway, that we're working on, but it is to build a digital companion for clients that we're serving. And I want you to understand the context that it's coming out of. This was, the case use scenario was the IRC operates a border shelter, a transit shelter for asylum seekers who have recently entered the country, have just been released from the border and are just entering the U.S. on this status, and they need rather than to be released onto the streets, they have a transit shelter there. And we provide services. They're very short term. They're there for 24 to 48 hours on average. And during that time, we have, we help them with some information about what the process they're in is, a little legal orientation, and then get them ready to travel onward to their final destination anywhere in the United States. So they come in all at once, short time, and then fan out. And that's important context because basically in that time we extract information from them. That's a sharp word, but it's the word, because we do an intake and we need information to know about where they are going to set up that transportation. We need to check their paperwork to make sure there aren't any errors because we correct them with the Border Patrol if it needs to be done before. And so we take down data from them and then again sort of send them on their way after some assistance, but then always our intention is for them to stabilize where they're going, but they're past us. So how could we know what is happening and continue to accompany them after this very short service period? So the notion of a digital companion was, how can we use this data that we already have from them, which includes, for example, the date of their court appearance that they may have. It's the location of that court. It's where the place where they're planning to go, a zip code, things like that, to help orient them after their travel when they're starting up. And so this is where it came from. Take this data and then use that to send messages to them about reminders for those updates on what's happening if there's been a change that we've heard about, find out whether or not they arrived, and then also information, more tailored information to the service providers that they could access there, whether it's legal service providers, case management, and so forth. So the idea was to interact and then also receive information back to them, from them about how they liked our services, what served them, what didn't, their satisfaction, but also what are they in need of now, what are they searching for now, and can we then respond and give them more information. So the idea is this automated system for sending messages to them based on the data that we have, and then a two-way interaction. Most of it in the current model data that we've tested with clients is is just an SMS type system, an automated messaging system, not unlike what you would have from your doctor's office reminding you of an appointment, or from your pharmacy when your prescription's ready. Simple technology. The big work on our end has been to integrate the database on the client information that we have received, and then also the data that we have on the responses, what kind of messages should go out. So it's very basic automated SMS type thing. But our vision for the future and where we're working towards is to have generative AI built into a chatbot, which would be able to respond more interactively to the progression of that client. So that is what we would call the 2.0 version of the newcomer. And I just wanted to say, while this is the case that we're developing in, that scenario of you've done certain things for a client, but they're no longer beside you, but may continue to need pointers, or we might want to have more information on how they're doing further down the road. That applies across many other case management and other services that we're involved with, people that we've helped to get jobs and so forth. So the same notion of a digital companion to augment, support, and also get more information on outcomes from clients in others is the vision that we have towards the future of the newcomer platform.
And can you talk a little bit about the role of public-private partnerships in order to get this going? You can either sit down or you can do it here.
Yeah, so, clearly, so already we have worked in the development on this in an interesting collaborative relationship with Zendex, which is the part of where our data on the clients has been stored, and that we've been augmenting a system for that. I think in general, for us to be able to continue to develop the resources from a technical perspective, we need clearly partnerships with the thinkers, such as in these universities, philanthropic. We also, to be able to seed this, we've had seed funding through Airbel, which also requires philanthropic type of support, but we also need the thought leadership that comes from the private sector on the technology, as well as on, I would say kind of breakthrough thinking. And then also, in many ways, one of the possibilities is the linkage to private and corporate type of assistance in the destination locations, right? So we might think first, our first mapping might be around public assistance office, but there's many other initiatives of support in communities, welcoming communities where they're receiving. And so to be able to essentially be a part of their network of outreach towards those that they're assisting is another way of partnership, I believe, with private sector that can grow.
All right, thank you, Ellen. So Emma,
Yes.
can you tell us about how you're using technology? You can come up here.
Okay.
You can stand around, you can Oprah it, you can do whatever you want. How you're using it in virtual resettlement services.
Yeah, awesome. And I'll just go on to the next. So hi, everyone. Super excited to be here today, and I'll try to keep this very short and sweet. My name is Emma Shah. I'm the Deputy Director for Virtual Services at the IRC, which really was formalized and came to life through the Virtual Afghan Placement and Assistance Program, which was really behind Robin Dunn-Marcos, who helped to kind of bring that to life. We are now running 3 different programs virtually. We have the virtual resettlement line, which is really, my dream is to make it almost like the 411 for all newcomers. So we mostly serve humanitarian parolees through the virtual resettlement line. They get our information and they can call us with any questions they might have. They're also connected then to services through the Office of Refugee Resettlement that they may be eligible for. We also have the Welcome Corps support line, which some of my ORR colleagues here are familiar with. That hotline provides support to private sponsor groups who may have questions about their Welcome Corps arrival. And so we answer those questions, and then again, we help them connect to their ORR services. So really looking at both of these as navigation tools and connections for newcomers to the services and benefits for which they're eligible. Finally, I'm going to talk a little bit about the Virtual Reception and Placement Program, which is brand new. It launched in March of this year, and to date at the IRC, we've already surpassed 1,500 individuals served through virtual RMP. So when we think, oh, thank you. And even more than that, right? Kathleen, through all of the other RAs who have partnered with us on this initiative. So I like to say virtual services is not some new innovative concept, but in refugee resettlement, it really truly is. We all know we're a little bit behind the times when it comes to refugee resettlement. But I will say, PRM and ORR have been great partners in really being at the forefront of innovation and trying to find ways where we can build capacity and support newcomers wherever they may be. So these are just some of the challenges and some of the key considerations we had to make when considering virtual case management. I think one of the biggest things that's hard for us, especially as people who are practitioners or who have been case managers for in-person services, is trying to think, but how do I do that virtually? How do I take my client to a doctor's appointment virtually? How do I help them apply for benefits virtually? Well, we forget that our clients are incredibly resilient. They are also very resourceful. So with that support virtually, they are able to go to a doctor's appointment. Then if they have any questions or needs, they can always call their caseworker. So I think really reframing refugee resettlement and support for these arrivals as empowering them, giving them the information, the resources, and then being on hand to support them should they need it. So these are, again, just some of the different ways that we've used technology in providing virtual case management. We provide cultural orientation virtually. We have virtual classes. Right now we have populations we're serving that are Afghan, and then also we have populations we're serving out of Latin America and the Caribbean. So we divide up our cultural orientation virtual classes regionally, as well as linguistically. And then finally, we're looking at even dividing them out into gender-specific cultural orientations. So those have been really successful, and it's also helped us build community too, because a lot of the regional locations where we have resettlement, we're seeing high rates of resettlement, obviously, in places like Northern California. So we focused on virtual cultural orientation, there. I'm not going to go through every single point here, just to keep my time short and sweet. But I do just want to address an additional tool that we use, which is Zendesk, which Ellen also spoke about. And Zendesk has been instrumental in making our program a lot more efficient. Our caseworkers have a lot more automation that's been integrated into their workflow, so they're really able to focus on serving the client rather than all of that arduous work of taking really diligent case notes. The case notes are still there, don't worry, PRM. But the caseworker can really focus on the service provision first and foremost. So with that, really quick, over 10,000 individuals have been served through all 3 of those programs since its inception. 6 national resettlement agencies are now providing virtual RMP, over $2 million. So we give out that direct per capita per client. And then now clients are served nationally in 43 states, also including Washington, D.C. Thanks, Kristy.
All right, so imagine it's 2034, I'm happily retired, and you are still doing this amazing work.
Yes,
What does
let's
it look
hope.
like? What does it look like in 10 years?
Well, my dream, as I said, is that one-stop shop phone line where any newcomer can call. And I really love the concept of copper, and I want to get together with you guys after this to talk more about that. And also, of course, the newcomers. I'm thinking about how can we integrate all of these things into virtual case management? How can we make the client experience better while also recognizing and empowering them? They are the leaders of their integration and resettlement. So I dream of it being something where we're still doing it. We still have in-person traditional RNP, right? Because we do have arrivals that need that level of support, but we also have this as an option for other arrivals. Thanks, Kristy.
Great. And last but not least, I'm very excited for you to hear from Emily Kaiser about Settle In. Settle In is an amazing tool for newcomers, and I'm so excited for her to tell you about how we're using technology.
Thanks, Kristy. Hopefully all of you have heard of Settle In before, but if not, I will give you a brief overview just so you can get some information. So we think of Settle In as a virtual learning and digital service platform. So it's a multi-platform, multilingual experience that we have for newcomers. So as you can see here, we've got a website and mobile app, which we're around first. So we have more than 1,000 resources on our website in 10 plus languages. We have the mobile app, which is more of a learning experience with kind of a gamified experience for people to learn. And then we, as of 2021, added the Facebook and messaging piece of that and that came similar to what Emma was saying, came right around the time of the Afghan evacuation. And so that was when that started. And so what we think about this is really just trying to get information about how life in the United States, what do you need to know? And we're under the Cultural Orientation Resource Exchange, which is the technical assistance provider for cultural orientation. And as part of that, we are kind of through the full continuum of the refugee experience. So the stuff that we have on the website and mobile app, those are often used overseas when refugees are going through the resettlement support centers. And they are able to use our videos, our fact sheets, and it really focuses on those key messages of what are the things people need to know in the first 90 days when they get to the United States. And they can use those too. So what we found is about 98% of folks who are coming from the refugee resettlement support centers are seeing some form of settle in before they get to the United States. So then they get to the United States and they go through cultural orientation again at the resettlement agency, or now with all these different pathways and these different forms like virtual RNP, they're going through it again. And so they're getting this information in a different format, a little more detailed, getting more kind of personalized to where they're actually living. And the great thing about adding the Facebook and the messaging component to this is really similar to what Emma was saying. These folks are very resilient and they really want to take control over their resettlement experience. So they're able to follow our Facebook page and get information that they need. And it kind of helps with what we talk a lot about, which is the cognitive overload that folks are experiencing. So if you think about the amount of information that you're trying to take in before you even get to the United States, once you get here, it's a lot. Trying to learn healthcare, the education system, how to get a job. And so the things that they might be worried about or thinking about when they first get here or before they get here might be very different than what they need to know at the 90-day mark, 6 months, a year later. And so, even if they learned it, they might need to refresh their memory because it's just so much information. So by following the Facebook pages, they're able to kind of continuously go back to that information, get reminded of things that they might have already learned, or get a little bit more detail than what goes into the initial cultural orientation. And then the really amazing part of what we do is that we have the digital community liaisons. So that's the messaging component of this. So on that, we have a team of 8 digital community liaisons. We currently support English, Dari, Pashto, Ukrainian, Russian, and now Spanish. And folks are able to message with someone in their language, ask questions, get personalized information back. And that team also, in addition to that, we have a content team that's doing videos, infographics, live events, articles, in those languages. So those DCLs are able to do all those translations, create all of this content. So we're really creating kind of this huge bank of content. We're able to interact directly with the folks who need this information. So it helps us with finding out what people want to know, what they're not able to find somewhere else, and we can develop that and kind of take in that information. We also can find out what kind of misinformation might be out there. So we were seeing a lot specifically during the Afghan evacuation. There was a lot of misinformation, a lot of confusion, and so we were able to see that in real time, people coming to us, and we were able to take that information and create content to kind of reinforce what they were learning about while they were waiting to get to their final destination, reinforce that messaging, and really support in that way. So there's a lot of different components to that. We would love to be expanding into more languages, and so that's kind of where we're at this point, is thinking through how can we make the messaging and the Facebook components more equitable and be able to expand to support other populations.
Right, and I will say that DCLs are really, they're the human element, and the way they weave technology with that human touch is really special. So, again, if you haven't checked out Settle In, please do. You kind of touched on this, but maybe you could talk a little bit more about how Settle In has enabled us to reach more people across a wider geographic terrain than we've ever been able to do before.
Yeah. So we are considered one of the unique pieces of this compared to other things that we are serving all the resettlement agencies and all the resettlement support centers. So no matter which agency you're coming from, you're able to access this information. And so for folks who might be in a virtual space, they're able to get the same information. We're able to serve more. And one of the great things too is we're really able to help all those agencies and really support what they need to do by having all this translation support and this system where people can get information. So when we get information from folks, we can create new resources, and we can really think through, and we're also hearing a lot from the resettlement agencies and the staff as well of like what sorts of resources they're needing, what are the topics they're needing information for. And so it's really great to be able to, from a virtual space, reach everybody and try. Our DCLs are amazing. They're able to do all sorts of research. So we get messages from people anywhere. They're going and digging into the data that we have, the information we have, the services in those areas, and able to kind of personalize information and give them really detailed thoughts. And one of the things, a really good example that we have on our team is we had a Ukrainian family who messaged us. They were living in Minnesota. They wanted to move to North Carolina, and they had family with health concerns. They wanted to be in a warmer climate for their health. So there was a lot of being able to kind of piece together a really comprehensive response to them of all the things they needed to be thinking about. So it's not just like, oh, get on a plane and head there and have a great time. It's really thinking through, like, have you talked to your resettlement agency, making sure we push them back to the experts that they've been working with and making sure they know that they're thinking about moving, and then thinking through the different components of, you need to find housing, you need to have a job, a stable job. You're not going to probably get the same types of services when you move. Thinking through like car insurance and your driver's license and all these things to make sure that people are making decisions that are going to actually be helpful in their life and not jumping too quickly. So we're able to kind of support from the back end too to make sure that we're giving the information that they get before they make too big of a decision and really think through those different components and really talk to the experts that they need to talk to before they make those decisions.
Great. So Jeanie, you heard a lot of different innovative approaches to use of technology. So you want to come here or stand there, whatever you want, and we'd love to hear your thoughts.
Great, thank you. And I have a few thoughts and then questions. Can people hear me? Yeah. Great, so first, just really, really inspiring to hear all of this work. So I hope you felt the same. I think what was really clear to me across the different interventions or areas is that these are, one, really pushing on what can be effective and actually work and be more scalable. And so doing all of that, but not just focusing on that, but actually there's a big focus, such a big focus on the user, on the person and their lives. And so I think the real focus on, is this person comfortable with it? Is this person, is this going where people are already going in terms of Facebook, not expecting them to come to them? Do they trust this? Will they trust this? Will they feel empowered? I heard that a couple of times, and really be able to feel like they're taking this in their hands. So it's not just about does this work and is it effective and can it reach more people, but actually how does this make people feel? How do they feel trusted? How does this fit into their lives? And how does this empower them? And so I think, and then how to reduce the risks as well. And so the sort of centering of all those things, I'm sure there are many other things, but to me those really stood out, how to be effective, scalable, while centering users and those people and while reducing risks. And so that's a through line I saw throughout. So actually I'd really love to ask the question whether, as you've been designing these, have there been trade-offs between those different areas. So as you've thought about how to make something most effective, how to really center those who will use it, and then how to reduce risks, or have you felt that those have been able to be balanced, and how have you thought this? I have a couple of questions, Kristy, if that's okay. So to anyone on the panel.
I can start if that's okay. So for us, I think, at least for me, one of my biggest concerns was around client safety and protection, and I think that's something that always has to be at the center of our work, along with, of course, empowering clients. But we've really looked at it as how can we still serve the client and do it with technological tools while also remembering the client's safety and ensuring that they're safe, right? And they are safe in their own home, et cetera. So we've been working really closely with our technical unit, which is Safety, Health, and Education, to really understand and help our virtual caseworkers look for those nonverbal signs, maybe when they're on the video call, and finding ways where we can use in-person practices virtually. And so really trying to kind of combine the two. I still think there's room to grow there, and I still think that's something that's always going to be kind of at the forefront of caseworkers who are doing this work. But I do think that there's ways that we're continuing to kind of evolve to a place where we feel comfortable that the client is safe and protected.
Great. Anyone else with thoughts on the trade-offs that you've had to work on between risks and safety, the user, the effectiveness?
Myself with the device, I would say that what we've been trying to do is to, like Milad said, try different languages and see how the device will respond. For example, I speak Swahili, I speak Kirundi, Kinyarwanda. Those languages, I know how people interact. I know how they feel when you ask them certain questions. So we had to try with me, and then we could see how the device is responding, and then we knew how to protect the clients, basically. And with more people speaking maybe Dari, Pashto, or other languages, we got to realize that this is the best approach to try on people before we give it to clients.
Mm-hmm.
Yeah.
Great, thanks.
Yeah, I think that to make it client-centered, when we look at newcomers, two key things, and I think it's a through. One, that it's individualized, so we're using the information that we have about the clients and they continue to provide to tailor to their particular scenario, to their life circumstances. And then, so individualized, but then two-way. So we are receiving more information. Did they move? Did they go to that court date? Whatever it may be. And so that information is highly personal. And so the questions around who has access to it, who is on the other side, the confidentiality of the data, especially as it becomes data that goes beyond the sort of pro forma information that we receive, which is, as things continue. So not the fields that we've already considered this way, but additional ones as they're incoming. How do we ensure that, only needs to know in client confidentiality? I think trade-offs to now are, to some extent, not broadening too wide, like containing the variety of information that we would gather, which is not ideal for a more complex exchange. But I think for confidentiality, privacy, and cost structure, and just mapping, containment or narrowing within the scope is key.
Yeah, and I would add for Settle In, because we're not delivering actual services, we're not doing direct services, we are very careful about what we are collecting or what we need to know. So we're only asking folks for information that we would need to answer the question. So if it's something, if they're looking for food banks in their area or something, we don't need to know their status or their full name or all these things that you might need to pull. So we're able, if it's based on what status they have and what they can access, then we might need to ask questions just about how they arrived or what their situation is, but that kind of helps with us protecting. But I would say, and it's been great working with Emma's team in that sense, because we can't provide those services, so that can be kind of a trade-off, is people kind of want to come to you and say, like, what can you give me, what can you offer me? And we have to say, you know, we provide information, we can't, there's something that we can actually provide you, but we send folks to Emma's team to say, maybe Emma's team can be able to provide you some direct services. So we work very closely in that it helps with that disappointment that people might feel that they're not getting any services from us or able to access anything, but we do have that additional resource.
Great, thank you. So I was just thinking about all the different perspectives in the room and the different partnerships that are, I guess, comprised in this room, and all that many of these intervention solutions have been designed with multiple partners. And so would love to hear from you, what are the key ingredients to successful partnerships, sort of top ingredient to successful partnership? And then what would your top wish be for accelerating partnerships? So accelerating these solutions, sorry, not accelerating it. And so key ingredient so far in terms of what makes it effective, and then these all need to be accelerated, even though I really liked in the last session the go slow and fix things. It's sort of like go as fast as possible given the needs, but slow enough to fix things. And so what's most needed right now that we don't have to accelerate the solutions and partnership? So who wants to start?
I'll be the sacrificial.
Yeah.
Do you want this?
Key success points and key wishes. Accelerant. Well, I think it's a lovely panel, and it makes me think of one, like early telephones in rural areas would have one single line, and it would be like there would be a community guideline of who can hop on the call and when it was your time, and then everybody knew that there other people would actually be listening in as well. And I would link that to the digital world and the virtual world, which there's this really great academic back east, some people in this room know, Louis Messiah. And whenever I do any work, he's like, that's not virtual enough, right? So I think for us a key success or like a key factor has been the freedom to define these things in this territory that's kind of uncharted. And as long as it's not digitally or virtually extractive, and it is in that co-creative process, I think it has momentum to go forward. There's obvious accelerants, and then there's probably more moderate or slow accelerants. And I think for me, I think of the word genotype, which is the word before you can make a prototype. So it's like, the bridge between the genotype and the prototype, the accelerant for that, I think would be the factor. Would you agree? Yeah? Yeah.
I don't even know where to start. Yeah, I would say the pieces that have been most helpful for us have been around partnering for subject matter expertise. So, we have a lot of subject matter expertise on our team, but in the sense of thinking through, we have a partnership with Refugee Housing Solutions. We worked with NRC RIM through Beth's team. So getting folks who have expertise in different areas to help us with content creation or verification of information to make sure we're doing it in the correct way, it's factually accurate, has been super helpful. I think when we're looking at accelerants and things that we need, obviously there's just money needed to have teams that speak all these different languages. So if we're going to have this human component to our teams, we just need the funding. And right now, a lot of our funding has been very focused on certain populations, which can limit us sometimes. It's been great as a way to get things started, but thinking through longer term, if it's very population specific, it does limit what we can do. And one of the things we're kind of waiting for and working to see how this will work is thinking through the amount of AI in the translation world. So it hasn't really kept up super well, or hasn't caught up really in some of the languages that we support in a way that can really support us in the way that we would like. So kind of waiting to see how that can develop so that we might be able to do a little bit more automation in terms of these different languages so that we can actually make sure that the information we're giving people is accurate and is not misleading people or sending them down in the wrong direction.
Yeah, I also agree, really agree with that point, because when she was speaking, I just thought of, let's think of Mark Zuckerberg, right? He had the idea of bringing Facebook to life. He knew how to code, but he didn't know how to code everything, you know? So we can do something, but we cannot make that exact thing that we want, basically. Maybe, let's say, for example, the device we're creating, we can code and all that, but the device will have bugs. Why? Because we are not really experts in creating that device, but there are some people who can help us create the device. So if we work with those people, then our device will be solid and our clients will benefit. If we don't, our device will be weak and our clients will just be disappointed and will not reach the goal of what we want to really reach. So, yeah.
Yeah, I think a great example of how that has happened on our team is that we did a post on Facebook about selective service and making sure that people are aware that they need to enroll. And you know, we had written it, and we had written the ages that you're required to enroll, who's supposed to be enrolling, and Facebook's auto translate, which will often come on. So like the English version is then, or one of the other languages is translated into English. The auto translate had put that you have to go up to 65. Which we can't control how Facebook auto-translates, and we can't fully turn it off. And so there was a lot of confusion in the comments of saying, wait, I thought that I was too old to enroll, and what's going on? Am I breaking the rules? Am I going to get in trouble? And so then we have to do posts explaining, like, please read the actual version that we write in the language. Don't look at the auto-translate. We can't guarantee that's accurate, but it causes, we can only do so much of controlling that technology.
Great. I have many more questions, but I see Kristy. I think we're opening up. So I will pass back to Kristy. Thank you very much.
Thanks, Jeanie. Yeah, I want to make sure we have at least 10 minutes, more or less, for questions from you all. So yeah, Sarah's going to be passing around the mic. If you want to raise your hand, whoever wants to get started.
Hi, my name's Mia. I'm with CWS. Thanks for all the fantastic presentations. My question is for Emily with Settle In. To preface my question, we did a 3-year program participant feedback project asking newcomers during the CO assessment, what do you wish you knew prior to your resettlement? By far, 75% said they wish they knew English before they came here. Knowing that Settle In is used by all resettlement support centers, has there been any discussion or funding opportunity to potentially provide virtual ESL or English language training resources to newcomers before they come to the United States?
That is a great question and a great idea. I love it. We have not specifically. I think with the being in the technical assistance and in cultural orientation, our limit has been fairly in kind of that information space. We've talked with we've done a little bit of research into partners that we could eventually get involved with that could help with that. I think what we've seen is that there's just such a limited overseas, it can vary so much at the resettlement support centers and access to the internet and how long that they're connected. So it's been really challenging. I mean, I think it would be an amazing thing to do, and if you have any good ideas of people that we could partner with or ways that we could get that going, we'd be happy to share that on Settle In and through those platforms to get people into those types of programs ahead of time. But yeah, it would definitely help people, I think, a lot to be able to do that.
Thanks. I'm Jen. I'm the CEO of an organization, a technology nonprofit called Peace Geeks. And we work out of Canada, but we work globally. We've worked in a bunch of different spaces. And so on that virtual ESL, I've got resources for you that you can potentially integrate into Settle In. But my question was actually around how each of, well, I've got many questions, but I'll limit it as well. One is whether or not you've thought about some integrations between a few of these tools, since obviously they're mutually reinforcing, and it will be really beneficial, besides just the kind of word of mouth of, hey, yes, and go look at this platform. But my first question was actually around how you're managing informed consent, like how you're walking people through. I was thinking in particular about the border, the transition shelter area experience, and yeah, just how you're talking to clients about informed consent of their data, both initially and in the long term, because we deal with that tension as well a lot. Yeah.
I guess I'll start since I was just thinking about your remarks before. So within IRC and also with our partners that we're working beyond that, I do think that there's a great deal of organic exchange of ideas and also people co-working, and we're working within the broader family of our Signpost project, which has long been delivering some digital companionship, I would say, that is a combination of human and then now more automated, and that is on, moving towards the integration of generative AI processes like that we're looking to do within newcomers. So there is a great deal of cross-pollination, I would there, and cross-learning and approaching challenges. So I think that there's, and maybe that was the point of your question before too, Jeanie, the more that we can do that with others, like that are here present and beyond this room, who are, tackling the same problems with ideas, the better. I think that we try to, avoid the silos and do the cross-learning and share the experience, and some key people can be accelerants of that process. So could be more descriptive, but I think that you're right in your thinking that this is what's needed to really further it faster and also to avoid the same pitfalls, I would say. With regard to informed consent, absolutely. Pretty much all the service that we're talking about using this in are highly personal, deal with a great deal of personal information, and also there are many as you move into broader players, our technology partners, our even our philanthropic partners, those who may have wishes around the use of the information and in what form. It is very important to the empowerment and to the understanding, and also I would say to the introduction to the United States and the world in which it's not only within our platforms, but beyond that, they should be aware of informed consent and what can happen with their data. So it's an opportunity to raise the understanding about uses and misuses of personal information. So we do have informed consent for specifically, and agreements also with anybody so we have with the clients, there's informed consent, and then we also have very clear data sharing agreements with the partners who are involved that are quite, I would say, protective of the clients and of course the organizations that are involved. So I'm not sure of the key for you, but it is a constant consideration, and the more we evolve, even with, for example, the AI within the work for that, the more that the boundaries of where the information is, who has it, and how it can be used, because now it's being used even to generate the answers, right? Or if it follows, so that is a use in of itself. So I think Jeanie and others might have more to say about that, but that would be my answer.
All right, we have time for, do we have any questions from the web? Okay, we're very techie today, so we're live streaming this, but no questions. They're a shy group on the web. So, other questions? Okay, we'll go there, and where else? Who said we have one? No, there, okay.
Thank you so much. Thank you again so much. This is an absolutely phenomenal conference and panel, and thank you again for everyone. This is so exciting to hear all these great innovation and these great initiatives. And apologies if this is a little bit too specific, but I really appreciate how you've talked about how do we protect, confidential information, also like consent of information. I'm also wondering if there's any safeguards in any of these platforms around how to make sure clients get connected, how can I phrase this? Like for different safety aspects, right? So there might be some refugees using, I don't know, Facebook chat or like different functions or like, these digital companions to talk about some sensitive issues that they may not be ready yet to discuss with a case manager or RAs. A lot of times that's around mental health, domestic violence, things like that. So I was wondering, has there been any consideration in these types of platforms or others that folks are using in the room, that automates some sort of response, right? Like, oh, I think my child isn't getting the right medication. Okay, you might need to call 911 potentially, right? Or I have a suicidal brother who's really struggling right now. Are there things that make sure that there's some safeguards in that regard to make sure that they connect, with additional layers of support? Hopefully that makes sense.
Will you share your name too and where you're from?
I'm sorry. My name is Christina Field. I'm coming from Moderators in Southeast Michigan.
Thanks. Who wants to
I
take that
can
one?
address that a little bit. So on Settle In, we work very closely with other teams within IRC. So we have a kind of very formal escalation protocol on our page, and we work with a lot of protection officers at IRC to talk about those signs, like the cues that we might have to, escalate things. And then we have specific people in IRC that we can go to escalate something that might need more assistance. So luckily we haven't really had to use it, or when we have used it, it wasn't from like a very formal required reporting perspective, but when we see someone who might be on the verge of being homeless, for example, we have kind of engaged that escalation protocol to kind of get them additional services and use that connection to, if they're close to an IRC office, getting them in to actually talk to somebody in person, because there's only so much that we can do through chat, and chat can be kind of slow, and it oftentimes needs, and sometimes we'll send people over to Emma's team as well, because you can talk to someone on the phone, so it's a much quicker interaction when there's a little bit more detail needed or more support needed. So we are always looking for those signs. We've luckily not had to do that, but from like a mental health perspective, the trafficking team. So we have a couple different folks that we can go to and ask for assistance if needed, so that our team doesn't feel alone in dealing with those issues.
All right. Raise your hand really high, because I'm sure I'm not saying all those questions that you all have. There we go. And then this will be, I think, the last question, and then we're going to wrap for lunch.
Thank you. My name is Sierra Arledge. I'm from Lutheran Community Services Northwest. I'm in Seattle. I use she, her pronouns. And I'm the Independent Living Program Supervisor, so I work with unaccompanied refugee minors. My question is for Emily about Settle In and CORE. I've seen your resources. They're awesome. Thank you for doing the work you do. I think oftentimes there's a real gap in information and like kind of lesson plans and available resources for specifically unaccompanied refugee minors, for especially teenagers. There's a lot of great information for adults, there's great information for kids, but it's that teen space that is has a specific need that there seems to be a lack of information for. I was just chatting with a colleague here who also is at an unaccompanied refugee minor program in Michigan. And one of the problems that we face is we don't have enough time in our days to develop the curriculum and the information and resources needed to provide these teenagers with the things that they need to know. So I'm wondering if Settle In and CORE has ever considered incorporating more specific programming, information, language, partnership that could benefit URMs and teenagers specifically.
Yeah, that's a great question. And I think it all comes down to, like resources and funding. I think that's, again, one of those spaces that we would love to do more in. But it can be, we're just, right now, I think the biggest challenge that we have is with the new pathways coming through, just for traditional refugees who are coming in. And so right now, we're even just trying to keep up with trying to update our current resources to fit the different pathways without even going into the unaccompanied minors. So I think we've had dreams of like, can we do like CO for minors? We have all these big dreams of things. We've also looked in, IRC has a great partnership with Sesame Street workshop that does a lot of that. That's for a little younger generation. But kind of thinking through like all these different ways. But again, would love to do that. I think there's definitely a lot of opportunity there. So if we can get the money and we can get the resources, we would love to do it. Okay.
Great. Well, we have some of the people that might be able to get that money in the room today, so we'll be looking you up at lunch. I'm going to pass it. Thank you very much to the panelists. I think that you guys did a fantastic job. I am going to pass it over to Kristy, who has some announcements for us, I believe.
Your lunch is 5 minutes out, but I have a pretty long announcement about lunch.
There you go.